Hello friends, myself Dr. SP De. Today we'll discuss the post-COVID mental traumas that are prevailing in the whole of the world, and we are getting so many patients who gets this panic attacks and anxiety episodes and mental stress like symptoms and mental traumatic mental trauma like ailments, and this type of things happening in all over the world. And COVID-19 is a pandemic declared by WHO and all the authorities of the nations and all the governments, and all we know that this type of situation is not in only in our country and not in only in India or Europe or America. This type of situation is prevailing in all the countries, and this type of patients are increasing day by day, and because of so many countries are accept the lockdown method, and in cases of lockdown there are so many jobless people, and lockdown makes the people far away from another people's their neighbors, their friends. Only the social media or internet or the devices are active. Social distancing is increasing day by day because of fear of COVID infection, and in this situation mental stress are increasing, the stress episodes are increasing, anxiety disorder, generalized anxiety disorder, manic episodes, obsessions, obsessive compulsive disorder and depression are increasing. So for the sake of discussion we will divide this discussion in 3 chapters. At first we have to identify who will be affected this type of mental trauma. At first the patients who will get the infection of COVID-19, then the primary contacts of the patient, and the primary contacts means the patient's immediate family members and relatives or physical contacts who gets the chances of COVID-19 much more because one of their contacts are COVID positive, and the general people. So let's talk about the patients of COVID-19. Patients of COVID-19, all we know, the patients of COVID-19 who are severely symptomatic and admitted in the hospitals, they are treated with so many drugs, and sometimes in ICU with oxygen and various type of IV drips. So there are no evidence that serious COVID patients all are getting thromboembolism or post-COVID dementia or post-COVID neurological involvement. But there are some cases recorded in the world that some cases are showing that there are some type of neurological involvement, but their number is very little. So if we get COVID positive in the next day, don't have any fear about that. You will suffer from a post-COVID long-term complications in respect of mind or in respect of neurological or brain involvement. So, but the situation is like that when a patient is suffering from COVID-19 and when he or she is getting admitted in hospital, the situation is there is all the nurses and doctors and the paramedical staffs are wearing PPE, they are maintaining distances, they are come one after another, talking less, working more. So it is very natural for the patients to accept these things because they don't watch this from their childhood. So but you have to learn how the doctor and nurses working in this type of COVID hospital where the COVID patients are treated. So be practical and be think positive that if I get COVID, if I will be a COVID patient and I am getting admitted in any type of hospitals, then I will be free within 3 to 5 or 7 days and become a COVID negative and go to the home, and I am absolutely maintain for some days of home quarantine according to the instruction of the doctor. Now the primary contacts of the patient, very much I feel and I experience that the main fear and stress will face by the primary contacts of the patient. So who is primary contact? When a patient gets COVID positive, according to the standard organizational instruction, within 3 days, when the patient gets COVID positive, within last 3 days, the patient is contacted to somebody, the family members or the friends or the office colleagues or they all are primary contacts of the patient who live or talk or spend more than 15 minutes with the patient within last 3 days. So this type of peoples, when listen that he or she is now tested as COVID positive, then this type of patients are peoples are very much fearful that I spend time with him or her in last 2 days for 2 hours or 1 hour in restaurant or bus or office or train or etc. I sure that I am now a COVID positive. So if you notice that if you spend some times more than 15 minutes with a patient who is now a COVID positive within last 3 days, you have spent the time with him or her, then first don't panic, isolate yourself, maintain home quarantine for 14 days, an absolute home quarantine in a room attached with a toilet and bathroom and detached from your, make as much as possible physical distance from your own family member, especially your elder family members whose age are more than 60, and then wait for any type of symptoms. If you want to do a RT-PCR test or antigen test, you can do it to exclude yourself become positive or negative, but you have to maintain a 7 to 10 days of isolation. We find sometimes that when you get infected, you may not be positive in test within 2 or 3 days. It may minimum take 5 days to become a positive. So it is the standard protocol. If you have a history of positive contact with a COVID patient within last 3 days, more than 15 minutes you have spent with this type of patient, then please isolate yourself in your home, in your house, and wait for next 7 days. And if you have any type of symptoms, then do a test or consult a doctor. And if you don't have symptom, still now you want to do test, to wait for at least 5 days, then do the test. And and we all are doctors are telling in the social media, and you study, you view the social media, that 80% COVID patients in generally are asymptomatic. So don't fear. Among you, your chances will be high among the you will go in the 80% patients, but in some cases remaining 20% patients will be symptomatic and 5% will be severely symptomatic. So if you do a test after 5 or 7 days and you will be COVID positive, then it will give so many times to you cannot become severe, because when you infected with COVID virus, then it will take 5 to 7 days to show the symptoms, and after the showing of the first day of symptoms, when the symptoms onset in your cell, after the onset of the symptoms, it will take 5 days to show the severe symptom. So if you do the test within 5 or 7 days, then it will give you time for your treatment and for your higher referral or higher consultation. Now come to the point of the fear of the general people. Suppose you don't have any relation with COVID patient and you don't have anything about COVID exposure. You are a normal man living in a room, eating nicely. You don't get the outside from the last 6 months. So, but you are in still fear because of this type in the this type of situation where the pandemic is prevailing on in the whole of the world. Then the media is very active and they are showing the each of the death in the front line of news, that this type of so many people are died in Mumbai for due to COVID-19. These famous people died in the famous nursing home irrespective of so many treatments, and this type of news creates fear within you. So try to watch as much as less COVID news and try to watch as much as less news channel for sake of fear. You can watch the news channel for other news, but try to avoid this type of COVID news, because we learn from the history when this type of acute viral diseases are outbreaks in the world, it will take at least 1.5 year or 2 years to go back or revert back. So maintain all the hygienic procedure, use mask, use all the physical and social distancing methods, and learn about how to protect yourself from COVID-19 from internet or WHO website or our government health ministry website, and try to keep yourself mentally fit, because if you stressed so much, your negative hormone, stress hormone will be high and it surely kill your immunity, irrespective of good food, irrespective of good immunity boosting methods. If you have the too much stress about COVID, or if you have the too much fear or anxiety about COVID or any type of situation, suppose you are very much anxious about old age father, mother, or you have a tension or anxiety or questions about your own career due to lockdown, then it will harm your immunity. So please stay in home and please don't panic. Try to learn those things practically from the practical viewpoint, and if you have any question in this regard, put them in the comment box of this video. I will try to answer my best, and if you have any further video in this type of topics, please mention, and if you like my video, please share in your social media platform with your friends. Thank you friends, goodbye.